Infectious agent detection by nucleic acid, DNA or RNA, influenza virus, for multiple types or subtypes, includes multiplex reverse transcription, when performed, and multiplex amplified probe technique, first two types or subtypes. Each additional influenza virus type or subtype beyond 2. Infectious agent detection by nucleic acid, DNA or RNA, central nervous system pathogen, includes multiplex reverse transcription, when performed, and multiplex amplified probe technique, multiple types or subtypes, 12 to 25 targets. This test is requested to determine central nervous system pathogens. The specimen is spinal fluid. Specimen retrieval achieved by spinal puncture is reported separately. The specimen is treated to isolate the nucleic acid. Nucleic acid is analyzed using multiplex amplified probe technique and includes multiplex reverse transcription when performed. This testing method has the ability to evaluate for several pathogens during the same test, multiple types/subtypes, 12 to 25 targets. Infectious agent detection by nucleic acid, DNA or RNA, respiratory virus, e.g., adenovirus, influenza virus, coronavirus, metapneumovirus, parainfluenza virus, respiratory syncytial virus, rhinovirus, includes multiplex reverse transcription, when performed, and multiplex amplified probe technique, multiple types or subtypes, 3 to 5 targets. 6 to 11 targets. 12 to 25 targets. Infectious agent detection by nucleic acid, DNA or RNA, respiratory syncytial virus, amplified probe technique. Severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, coronavirus disease COVID-19, amplified probe technique. Severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, coronavirus disease COVID-19, and influenza virus types A and B, multiplex amplified probe technique. Infectious agent detection by nucleic acid, DNA or RNA, severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, coronavirus disease COVID-19, influenza virus types A and B, and respiratory syncytial virus, multiplex amplified probe technique. Staphylococcus aureus, amplified probe technique. Staphylococcus aureus, methicillin resistant, amplified probe technique. Infectious agent antigen detection by immunoassay with direct optical, i.e., visual, observation, Streptococcus, Group B. Clostridium difficile toxin A. The specimen may be vaginal or rectal swab. When referring to primary source infectious disease codes, direct optical observation is a testing platform that produces a signal, such as a colored band, on the reaction chamber that can be interpreted visually. Infectious agent antigen detection by immunoassay with direct optical, i.e., visual, observation, HIV-1 antigen, S, with HIV-1 and HIV-2 antibodies. Influenza. Specimen may be oral fluid, plasma, or whole blood obtained by fingerstick or venipuncture. Infectious agent antigen detection by immunoassay with direct optical, i.e., visual, observation, respiratory syncytial virus. This test may be requested as a rapid antigen test for respiratory syncytial virus, RSV. Specimen collection is typically by nasal swab, nasopharyngeal aspirate, or nasal wash. Infectious agent antigen detection by immunoassay with direct optical, i.e., visual, Observation: severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, coronavirus disease COVID-19. This test may be requested as a rapid antigen test for SARS-CoV-2 or COVID-19. In one method, a nasal swab specimen is collected from the patient and a specified number of drops of extraction reagent are added to the top hole of the swab well. The sample is then inserted into the test card via the bottom hole of the swab well and pushed upwards. Once the swab tip is visible through the top hole, the swab is rotated 3 times clockwise. The card is closed, which brings the sample into contact with the test strip. Results are interpreted visually at 15 minutes. Infectious agent antigen detection by immunoassay with direct optical, i.e., visual, observation, Trichomonas vaginalis. This test may be requested as a rapid antigen test for Trichomonas. Sample is vaginal swab. Detection is by immunoassay with direct optical observation. Infectious agent antigen detection by immunoassay with direct optical, i.e., visual, observation, adenovirus. This test may be requested as a rapid antigen test for adenovirus. In one method, the patient's eyelid is lowered and the inside is dabbed to saturate a sample pad of a rapid screening device. The pad is placed in a buffer solution to active. Results develop in approximately 10 minutes. Detection is by immunoassay with direct optical, i.e., visual, observation. When referring to primary source infectious disease codes, direct optical observation is a testing platform that produces a signal, such as a colored band, on the readout window that can be interpreted visually. Infectious agent antigen detection by immunoassay with direct optical, i.e., visual, observation, chlamydia trachomatis. This test may be requested as a rapid antigen test for chlamydia trachomatis. Samples include endocervical swab and cytology brush specimens. In one proprietary method, an endocervical specimen is obtained and placed into a tube containing an extraction solution reagent. After 2 minutes, a neutralization solution reagent is added. Following extraction and neutralization, a specific number of drops of the extracted sample is added to the test cassette sample well. If the extracted sample contains chlamydial antigen, a positive result is indicated by a red test line along with a blue control line. Infectious agent antigen detection by immunoassay with direct optical, i.e., visual, observation, Neisseria gonorrhoeae. This test may be requested as a rapid antigen test for Neisseria gonorrhoeae. Specimen may include urethral or endocervical swab. In one proprietary method, a swab specimen is collected from the patient's urethra. The swab is placed into an extraction tube to which a specified amount of extraction buffer has been added. The swab is rotated against the tube to express the liquid. After 2 minutes, another extraction buffer is added. Extraction is performed for another minute in the same way. A specified amount of extracted specimen is added to the specimen well of the test cassette. A positive result is indicated by 2 colored bands appearing on the membrane and may be interpreted visually in approximately 15 minutes. Infectious agent antigen detection by immunoassay with direct optical, i.e., visual, observation, Streptococcus, Group A. This test may be requested as a rapid antigen test for Strep A. Streptococcus A is a form of beta hemolytic Streptococcus. Sample is throat swab. In one test method, a throat swab specimen is collected, an antigen is extracted from the specimen with reagents. A dipstick is added to the extracted sample. If the sample contains strep A antigen, a positive result is indicated by the appearance of a pink to red test line along with a blue control line on the dipstick. Infectious agent antigen detection by immunoassay with direct optical, i.e., visual, observation, not otherwise specified. This test may be requested as a rapid antigen detection test. Samples vary. When referring to primary source infectious disease codes, direct optical observation is a testing platform that produces a signal, such as a colored band, on the reaction chamber that can be interpreted visually. Infectious agent drug susceptibility phenotype prediction using regularly updated genotypic bioinformatics. This test directly and quantitatively measures resistance of a patient's viral infection to drugs in order to help the physician select appropriate drugs. Drug susceptibility is measured by comparing luciferase activity produced in the presence and absence of drugs. Susceptible viruses produce low levels of luciferase activity in the presence of PRN/or RT inhibitors, whereas viruses with reduced susceptibility to these drugs produce higher levels of luciferase. Infectious agent genotype analysis by nucleic acid, DNA or RNA, cytomegalovirus. HIV-1, reverse transcriptase and protease regions. HIV-1, other region, e.g., integrase, fusion. Hepatitis B virus. Hepatitis C virus. Genotype assays are useful in detecting potential or actual drug resistance in a particular virus. The DNA of cytomegalovirus is isolated for an amplified by polymerase chain reaction to detect mutations that are related to antiretroviral pharmaceutical resistance. Hepatitis C virus, HCV, DNA is isolated using reverse transcription. Code 87912 is reported for the isolation and analyzing of 10 hepatitis B virus, HBV, genomes that identify those at risk of HBV disease progression and also to determine optimal antiviral therapy. Infectious agent phenotype analysis by nucleic acid, DNA or RNA, with drug resistance tissue culture analysis, HIV-1, first through 10 drugs tested. Each additional drug tested. A phenotype assay that may be required when newer drugs are being considered for treatment of HIV. Infectious agent enzymatic activity other than virus, e.g., sialidase activity in vaginal fluid. This code is used to report the enzymatic activity of an infectious agent, other than a virus, using an immunologic technique.